C2 plus IVL catheter treatment has come to Paras Hospital in Gurugram. Can you tell us the merit of it? And you also had an experiment of it on the patient, and it was a successful. Thank God. You also say thank God.
Thank God C2 was there with us. We've had 3 cases done so far in the last 1 month now. This was launched on 2nd of August and we had this pleasure of using, thanks to the management and cooperation of everybody involved, we were able to use this on the 5th of August in a patient who literally required it. It was a very heavily calcified blockages. What happens is, if you're a diabetic or a smoker or an elderly age group, the blood vessels get plugged with calcium. So when calcium is there, calcium is our worst enemy during angioplasty, during ballooning, during stenting, because nothing expands, nothing goes. So this is a similar technology what we used to use for using laser for breaking kidney stones. So same way the technology goes in, uses infrared rays, breaks the calcium into smaller microparticles. With the filter we suck out those particles and then we create a space. Many times we can avoid a stent in such cases in a younger patient, or sometimes even if we have to put a stent, the longevity of the stent and the excellence of the stent goes much more, and the chances of requiring an open heart surgery or chances of requiring other modalities decreases.
And you, when the patient came to your place at Paras Hospital in Gurgaon, and when you implemented this technique, and I guess the time was very critical.
So time is muscle in cardiology. The timing was at 1 o'clock in the night. The patient has come gasping, no pulse, no BP. Credit to the entire emergency team and the staff who were there. 40 minutes of cardiac massage in medical science, success rate is only 5 to 6%. And of survival and success rate of symptom-free survival is less than 1%. Otherwise, even if people who survive, they have some amount of brain damage, slurring of speech, difficulty in walking. By God's grace, she is absolutely fine. We were able to intervene in time, effective CPR, followed by immediate involvement of the cardiology team, and we went there, opened up the arteries, and plus use of availability of appropriate techniques which helped us in doing all this.
How do you see this technique getting more traction in India? Because India is also coming up as a heart patient or heart issues which are getting a lot more in number and increasing every day.
See, India is already the diabetic capital of the world. Because of diabetes, the risk factor of having heart ailment is 3 times higher. And because of diabetes, because of pollution, because of smoking, what happens is the blood vessels, they are moth-eaten, they are all termites. So they become like calcified, hugely calcified, so where conventional angioplasty becomes very challenging.
And also the open heart surgery, which is a time-consuming and a lot more tedious and complicated operation.
That could be done in stable patients, open heart surgery, but in unstable patients like these, this has come like a real boon, which was there. And plus time is essence. Everything, time is essence in cardiology. If we treat in time, we are able to give excellent results.
One important question that we are seeing in after post-COVID, sudden death is what is eating up a lot of lives. You have talked about it. What do you say about sudden death and why it is happening? And is there a possibility of this treatment being administered to patients so that they can avoid sudden death?
See, we have the sudden deaths. Majority of people having young age groups are due to thin cap blockages. In Paras, we have a facility of IVS and OCT, intravascular ultrasound and OCT, wherein we can detect these thin cap blockages. If you have a thin cap blockage, suddenly the plaque will rupture or suddenly the blockage will become 100%. So incidence of sudden cardiac death is very high in such cases. So the key is to identify these thin cap blockages and control them, and prevention is still the best form of treatment.
This year, C2 plus IVL, do you see this getting more traction in all over India or other parts of the country as well?
Absolutely. The other part, even now there are cases, South India they've done, yesterday one case in Bangalore they've done one in Chennai also yesterday. So these are cases which were earlier given to the surgeons for open heart surgeries. Now we can avoid open heart surgeries by these cases, and we can also avoid stents to some extent in these cases. So this is definitely a boon in technology, and over a period of time as the technology advances, I am very sure that we can even avoid stents when we are using this.
When you use this layup, this technique on a lady who is 50 plus, and how has been her recovery so far, and what is the advice that you give to the people at large, pre, during and post?
So pre, obviously we were doing a cardiac massage, there was no pulse, no BP. Post, she has recovered to 100% capacity. She's doing everything what she was doing before. She's become 10 years younger now. She's exercising as she told you, and she is totally back to normal. That is the beauty of it all. There are no scars, and we are only about 10 days into the procedure now.
And finally, one last question. What is the advice you give to public at large if they are at all feeling uncomfortable, or they are not feeling what you call the patient is not comfortable in normal sense?
So especially if you're not comfortable, any uneasiness, if it is there, there is a loading dose which is available in the hospital or at home. You should keep a loading dose at home. Loading dose means 325 milligrams of chewable aspirin. If you cannot swallow, you should put in a spoon and take it. Second is clopidogrel. There is a medicine called clopidogrel, 75 milligram, 4 tablets of that. And the third medicine is called 80 milligrams of statins. These 3 medicines will decrease the death rate by 44%. So anybody who is at home, whose relatives are there, who's having a cardiac disease in the family, should have a loading dose in your pocket. A loading dose in your pocket will save your life, save your patient's life. A 500 rupee note or credit card may not be able to do it.
Thank you, sir, for the time and for the great research and the great practice. And hopefully, people at large will benefit from your new experiment, and at the same time using the latest technology in heart care.
Thank you so much for the kind words.